ask you about the social impact. Does something like this, where people are forced to self-isolate with very little information, with very little testing, with very little belief in what they're being told, how do you see this affecting society?
Well, the immediate issue is the issue of trust, whether people trust their governments and whether people trust what they hear in the media. Because to have effective quarantine, you need the cooperation of the population. And that's a very problematic issue because this kind of trust has been eroded over the last few years. The other big issue, more long-term, is about surveillance. One of the dangers in the current epidemic is that it will justify extreme measures of surveillance, especially biometric surveillance, which will be, again, justified as a means to deal with this emergency. But even after the emergency will be over, it will remain. We are talking about a system of monitoring an entire population all the time for biometric signals, allegedly in order to protect people from future epidemics, but this can also form the basis of an extreme totalitarian regime. We are facing a huge issue of surveillance and privacy in our age, and I think that we'll see a big battle between privacy and health is likely to win. That people will have no privacy at all in the name of protecting them from the spread of such epidemics. Now, the thing is that the technology can be very effective. We now have the technology to monitor entire population and discover, for example, the outbreak of a new disease when it's only just beginning and it's very easy to contain it and to follow all the infected people and know exactly where they are and what they do. But this kind of surveillance system can then be used to monitor many other things, what people think, what people feel, and if we aren't careful, this epidemic can give justification for the accelerating development of totalitarian regimes.